Varanasi, the holy city of Uttar Pradesh, has been struggling from COVID-19 since last month. The second wave affected the oldest city, which also happens to be Prime Minister Narendra Modi's constituency. The holy city is also famous for getting moksha. People from all over the country come here to take a dip in holy river Ganga. While corpses burning is a common sight all around the year along the river ghats. This time, however, the images were gruesome, with lakhs of people thronging the city for the ritual of dead. In all this, Varanasi's system to deal with COVID went for a toss. Till the first week of May, Varanasi was among the top 5 worst affected districts in Uttar Pradesh. But today, the data shows that the daily average cases in Varanasi, which peaked at 2,146 on April 25th, has dropped below 400 now. The district's daily average death has also come down to 10 from 14 in the last week of April. So how did Kashi deal with the virus? The task of bringing down the COVID cases was tasked to A.K. Sharma, an ex-IAS officer, now a BJP MLC in Uttar Pradesh and one of PM Modi's most trusted lieutenants. From day one, Sharma summoned top officials of the district administration, municipal corporation and police to take stock of the situation. It started with a 24/7 command and control room with 20 dedicated phone lines and round-the-clock manpower was set up. The Kashi COVID Response Center became the hub of coordination between various arms of administration, as also interface with the people for a seamless management of the situation. The administration also ramped up RT-PCR testing capacity of the city from 5,000 to 12,000 per day, while making sure that the results were made available within 24 hours. The next thing that was done was the administration directed district officials to set up multiple layers of checking at different levels, both in urban and rural areas, right from block to Gram Panchayat level, and in charge for everything, be it ensuring that enough samples are getting tested, to distributing medicine kits to those infected and showing mild symptoms was placed. Rigorous meetings were held on a routine basis to check that officials are delivering on the ground. The administration then focused on the rural hinterlands. 70,000 medical kits to contain the pandemic were distributed, and the healthcare staff at the primary and secondary dispensaries were trained with oximeters and other testing paraphernalia. The result has been heartening, with the distress calls from rural areas coming down from a peak of 800 per day to about 100 at the command and control center.
मेडिकल इंफ्रास्ट्रक्चर की जो कमियां थी, उनमें जो तुरंत हम लोग हस्तक्षेप कर सकते थे, जो तुरंत सुधार कर सकते थे, जैसे HFNC वेंटिलेटर को मंगाना, कम थे, ज़्यादा आ गए, ऑक्सीजन सिलेंडर्स को मंगाना, वो भी कमी थी, उसको भी मंगाया गया, RNA एक्सट्रैक्टर के जरिए RT-PCR टेस्ट की गति में बढ़ोतरी करना, उसकी भी कमियां और उसकी भी 2 मशीनें हम लोगों ने नहीं मंगाई। तो इन सब कामों के चलते ऑक्सीजन की सप्लाई पर बहुत काम हुआ, ऑक्सीजन प्लांट नए बनाए गए।
Currently, Varanasi has an adequate oxygen supply to meet its total demand, while the bed availability stands at about 60%. Meanwhile, vaccination in Varanasi is also on an upward trajectory. An average of 6,177 daily doses were administered in the district on 1st May. The number has increased to 6,684 as on May 28th. Prime Minister Narendra Modi recently praised the authorities in Varanasi, saying their efforts to ramp up the availability of oxygen and ICU beds were exemplary. He told doctors and frontline health workers of his constituency that more attention is to be given towards maintaining the situation in villages of Varanasi and Purvanchal. Today, the city of Kashi is coming out of the dreaded second wave with a sharp decline in daily infection. The model of Varanasi could be a case study for other cities to be prepared for the third wave of corona.